My journey into medicine started with the pregnancy of my own first child. I was so fascinated with what was going on inside of me and couldn't believe that my body could grow another little human being. So I read everything that I could on the topic. I read about pregnancy, labor, birth, breastfeeding, and by the time I was done with my reading, I was convinced that the best way to handle birth was to leave things as normal and natural as possible, as long as everything was going okay. I communicated that with my physician and told him I wanted no interventions at all, unless it was absolutely necessary. He put his arm on my shoulder and said, "Don't worry, sweetie, we're going to take good care of you." Somehow I found myself less than reassured at that comment. When the time came to birth, my husband and I had prepared with childbirth classes. He was a great assistance to me to help me relax, to help me breathe. And I was able to get through the whole labor as planned without an epidural or any pain medication at all, which kind of amazed the nurses. I didn't realize how common it was for women to have those things. When it came time to actually birth, I was in a very bright room with a number of people watching me work very hard, in an uncomfortable bed, in an uncomfortable position, being rushed because my doctor was trying to get to the next lady who was waiting on him for the delivery. After the baby was born, I got to hold him for 5 minutes with a very brief attempt to nurse him before he was whisked away for 4 hours without any explanation as to why he was not with me. I found out later that it was just the policy of the hospital to observe in the nursery for 4 hours. Fortunately, many hospitals have changed those policies now, so moms are more likely to be able to stay with their babies. In reflecting over my experience, I decided that I wanted my career goal to be helping other women have a safe, respectful birth with the understanding of the normal natural process, and also taking into account their own special needs and desires. My study of medicine confirmed that many of those things that I learned during my own pregnancy were true. That when all is going well, any interventions that occur are more likely to cause a complication than to help out. Therefore, I believe that we should leave this process alone as long as everything's going well. One of the authors that I came to know is an author named Dr. Sarah Buckley. She's a physician from Australia, and she wrote a book called Gentle Birth, Gentle Mothering. In this book, she talks about the ecstasy cocktail of hormones that women experience during the birth process. I'm going to tell you a little bit about the 4 primary hormones so you can understand a little bit about what women experience in unmedicated, undisturbed birth. The first hormone I'm going to talk about is oxytocin. Oxytocin is the hormone of love. It's a hormone produced both by men and women when they are in each other's company and enjoying each other. It is produced during labor in small amounts in the beginning and rising to very high levels by the time the baby is born. It also rises in the baby. So by the time the birth occurs, both mom and babe are bathed in a hormone bath of love. The second hormone I'm going to talk about is the group called catecholamines. Catecholamines are our stress hormones. So whenever you're in a situation of stress, like labor, the catecholamines are produced to help you deal with that stress. If a mom is afraid or feels in danger, the catecholamines can go so high as to actually stop her labor. Then she needs assistance to move on. But in the normal process, that hormone level grows, again, until time of birth. Again, both in the mother and in the baby. Now, in the baby, the catecholamines will help the baby breathe outside of the womb. If a baby does not go through any labor, babies have a harder time adjusting to breathing outside of the womb and may be more likely to end up in neonatal intensive care for a period of time until they can make that adjustment. So stress is a part of the normal birth that needs to happen. The third hormone is the hormone prolactin. Prolactin is the hormone that helps with the production of milk to feed the baby. After a baby is born, if a baby is dried off and placed immediately on mom's abdomen, the baby literally will crawl to the nipple, using its arms to propel itself, using its little feet to push. As it's pushing its way across the abdomen, it's massaging the uterus to help with the delivery of the placenta and also to help control bleeding after the placenta delivers. The infant is drawn by the smell of the nipple to the right place and will latch on all by itself, gaining strength in its neck muscles and its arms as it makes that journey. I often wondered why it was that human babies don't do this when we know that animal babies do. The answer is most of the time in a hospital setting, after the baby delivers, it's taken away from the mom to a table where it's examined, maybe washed, maybe poked, prodded, all the procedures done, wrapped in a blanket, given back to the mom, and the mom is told to now feed the baby. I'd like you to consider the difference between a baby learning to eat versus a mom learning to feed her child. And you can understand why that breast crawl, as it's called, is important for infant survival and is promoted by the World Health Organization to prevent infant mortality. The fourth hormone is endorphins. Endorphins are our own chemical pain relievers that act like opiates in the brain. So when you talk about moms experiencing ecstasy or euphoria after delivery, the endorphins have a lot to do with that. The endorphins also play a role in a mom's being able to tolerate this process of labor. If a mom receives any medication, an epidural, or narcotics during her labor, those endorphins will not pass the brain barrier, and she will not have that same feeling of ecstasy, euphoria when that child is placed in her arms. Birth can be transformative for mothers. And sometimes it's transformative in very special ways. I had a patient who shared with me that she had had a very difficult childhood, experiencing things that little girls shouldn't have to experience. When she became pregnant with her first baby, she labored, uncomplicated labor, but when it came time to push, she shut down. It was a place she couldn't go. She ended up with a cesarean delivery for that baby. With her second pregnancy, she and her husband had spent a lot of time talking through what had happened to her with that first delivery. And she came to me saying, I really, really want to have a vaginal delivery this time, and I believe you're the one to help me do it. Will you? My answer, of course, was yes. So I watched her go through her pregnancy, and then I was honored to be present when she labored that second time. Got to the point where she was ready to push. She pushed a couple times, and she looked at me and she said, here's where I stopped last time, but I'm going to do it this time. And she did. I was very pleased to be able to place that baby in her arms. A successful birth and a successful transformation, getting healing as she delivered. So, my wish is that we would honor birth as birth was meant to be, honor the normal process as long as things are going well. And what we will find is women who, going through this process of birth, have found new strength within themselves that they didn't know was there, new courage to face whatever trials come ahead of them. Partners will look at the mother of their child in a very different light, with wonder and awe at what she was able to do, and thankful that it's not them. Babies nourished through the pregnancy by a mom focused on their growth and their care, and then born without chemicals to disturb the normal reflexes within, will find themselves nursing like a champion, getting the best food for them through the breast milk, and will have less obesity, diabetes, all kinds of illnesses that can be affected by weight and by that early diet, and live healthier, happier lives. So I believe that as we honor birth as it was meant to be, we ourselves will be reborn, as will our nation and our society for generations to come.